Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Garland.
Hey there, everyone. Thank you for joining me today and my guest, clinical psychologist Emily Edlynn, who is here to discuss the causes and impacts of chronic pediatric GI distress. Now, she'll explain how pediatric psychology can help both children and their parents or caretakers cope with and improve symptoms. Dr. Edlynn is currently the director of pediatric behavioral medicine at Oak Park Behavioral Medicine in Illinois. Now, previously, Dr. Edlynn was an assistant professor in the School of Medicine, the Department of Psychiatry at the University of Colorado in Denver, where she served as the clinical director of a hospital-based school program for youth with chronic and serious medical illness at Children's Hospital for over 3 years. So she's obviously the perfect person to discuss this topic of pediatric distress today. So welcome, Dr. Edlynn, and thank you for joining me today to have this discussion.
Thank you so much for having me.
Oh, you are so welcome. Now, as adults, it can be challenging to cope with the stress of GI symptoms, and we can only imagine how this same pain can affect children. Now, what would you say, first of all, are the common stressors on children?
So I think social stress is really primary, and that can change across the developmental stages, but that is something really key that is a little different in adulthood, where we have our established relationships. Usually we know what we're doing, but kids are really trying to figure out their social relationships, and that can really be affected by GI pain and problems, as we'll discuss. And then there's also cognitive development, the academics and participating in school, and GI distress can really interfere with those aspects as well. So there are a lot of developmental considerations for children and adolescents managing GI distress.
Now, I'm always fascinated, as I'm sure many people are, of the connection between the brain and the gut. So in children, is that enteric, or the nervous system, that the brain gut, is that all developed well, or is it still developing?
Well, we know the brain is a playground during childhood of lots of neurons changing and neuronal pathways changing. So it's much more plastic than adulthood. Around 26 is when the brain is pretty much well formed, including the frontal lobe and executive functioning, which is like how to plan ahead and organize ourselves, for example.
Yeah.
So in kids, because it's so plastic, that's one of the greatest parts about treatment, is that it's easier to really shift how those pathways are working together. So when it comes to pain, for example, what can happen in chronic GI pain is there has been a misunderstanding. The system has gotten confused and is sending pain signals when there is no actual harm being done in the body. And so what we can work on is how to retrain the brain. That's what we say. And
that's so interesting.
Yeah.
So when we talk about GI distress, it's sort of like the chicken and the egg kind of thing. Like, what comes first, the anxiety or the symptoms? What are you seeing? What's common? What are some of the typical GI symptoms that you're seeing in children?
So I completely agree that the pain and the anxiety are very closely connected and actually really influence each other. So it can be really hard to tease apart what's primary, and there may not be a primary, to be honest. We really are in treatment targeting both typically. So in children, really commonly is anxiety around social situations. If they're going to have pain or other GI symptoms that might be embarrassing, like an accident at school or around friends, that can lead to avoiding situations and not doing fun things that normal kids and typical kids are doing. So that is a really big thing I see. And then I also see avoidance of school because of feeling uncomfortable and anxious about how to get through the day with their GI symptoms.
I remember several years ago listening to, and you probably know of this amazing researcher, Dr. Rona Levy. And she did a paper on the correlation between a parent's reaction to the child's pain or symptoms of pain and correlating with the intensity of that pain, something like that. And I think it brings to light an interesting point. Whereas, what is the role of a parent's reaction to something like going to school or being fearful, and how does that intensify what the child may be experiencing?
Absolutely. I mean, this is really the crux of pediatric treatment is the parents. Which, imagine that. But it's great because it's not to blame parents, but it's more to empower us that parents actually have a great degree of influence. And so we may not be able to control everything, but we can influence it very heavily. So we also know similar research in when kids are getting shots, for example, a parent's distress predicts the child's distress around the shots. So it's very clear how linked a parent's anxiety is.
Yeah, and I don't mean to bring up my personal life, but I'm going to, because I'm always amazed. My niece is not quite 2, and she's falling down. She's getting little bumps, and she's very active. And the way that my brother and his wife, her mom, my sister-in-law, react. My niece, she's never crying. She's like, my sister-in-law goes, "Are you okay?" She's like, "I'm okay." And she gets up and she goes. And I think it really impacts how she's, it doesn't probably really hurt, but if my sister-in-law is freaking out, I'm sure my niece would be freaking out.
Absolutely. Because they're looking to us, they're checking us. What am I supposed to be feeling here? Is this safe? Am I okay? Right. And so if we are seeing danger, they're going to see danger. So we can really set the tone.
Yeah. And I wanted to bring this up because I want to frame this discussion in what you just said, the role of the parents. So we talked about some of how common these symptoms are, but what are some of the common anxiety triggers for kids with GI disorders?
A big trigger is food, and that really affects social functioning as well. And it can also influence parent anxiety around food. Is how I feed my child, how is that going to affect their GI distress? And so then a lot of food avoidance and restriction can happen. And that is a really hard way to live. That is a very primary way I see anxiety playing out.
And we're not trying to slam parents at all, but
Nope.
We're all consumed with our diets and trying to eat healthy. But if we have our own food insecurities or our own food issues, it may have an impact on how our children are viewing food and eating. Correct? Would you say that that's a true statement?
100%. I mean, the research bears it out everywhere. And again, I agree. I really want to empower parents and not lead into blame or shame. It really is seeing how much we can make a difference and then embracing that change.
Yeah. And again, we love you, parents. We're trying to help you. That's how we've brought this amazing Dr. Edlynn on, and she's done an amazing course that we're going to talk about later. It's really to empower parents with more information so they can help their children in the best way possible. So we love you. This is not a slam on you at all.
Right.
So with that said, can you give us some examples on how to help children when they can't sleep, for instance? Like that's an anxiety.
Right. And it can definitely play out with GI distress, right? So that can disrupt sleep. It can cause anxiety around falling asleep. So then there's problems with falling asleep. Waking up, there can be, from pain, there can be anxiety about how long will this pain last. So what I counsel parents, well, in general, there should be a really good sleep schedule. That is across the board, pain or no pain, GI distress or no distress. We all need good sleep routines, parents included.
And consistent, right?
And
like try to get the same time or close to the same time.
Yes. Bedtime, wake up as consistent as possible. And then having a really good wind down sequence before bed. So it's cues to our body and our brain that we're preparing for sleep rather than activity.
So, I love that. So what are your little tips for like wind down activity, like a bedtime story,
right?
Like, playing lullaby music or something.
Right. And it's going to be different for each kid, what fits them. But, For some, okay, when my kids were little, the bath was not relaxing. They got super hyped. It
Yeah.
was way too much fun. So, but an older kid, a warm bath might be perfect, like this really relaxing physical experience. Reading, even drawing, whatever feels calming to the kid going into bed. I definitely stay off screens. That is activating. Harder sell with teenagers, but that's another story. And then I really work on, with almost every kid I see in my office, a meditation practice. So it can be super quick, 3 to 5 minute meditation. But what that does is it's really part of that brain training I talked about earlier of how to be calmer and less reactive in general. And that helps with pain, because the pain and anxiety cycle is all about reacting with alarm and fear. And meditation helps our brain respond more calmly in general. So it's a really nice practice to integrate.
And it's never too soon, right? You can be young and doing this meditation.
Yeah.
It's a great thing to learn. That's so awesome.
There are some great kids meditations just free. You can go to YouTube, or Insight Timer is a great app, and just search kids meditations. And there's some really fun ones. They're playful, they get their attention. It's not the same as adult meditations that kids would probably just like get bored in 2 seconds.
Well, maybe that's a good thing.
Yeah.
But you talk a lot in your course, you talk about confidence and resilience. So what are your tips to help improve a child's confidence and resilience?
A lot of times the family is in the medical system to eliminate the GI distress, right? To cure it. And when it becomes chronic, where that is more complicated, and then they are working with a psychologist or a therapist, our focus is how to live with this right now and increase confidence that you can live the life you want, even with these symptoms. So a big piece of that for parents is to really encourage and maintain behavioral expectations. So kids with GI distress should be doing what other kids in the family do: chores, helping out, participating in family movie night, doing that things that the rest of the family is doing.
So again, it's like not ostracizing or making the child feel like they're different from everybody else, because that could, contribute in some way to more distress.
Yes, absolutely. That's, feeling separate, feeling there's something wrong with them. There can be a lot of more emotional symptoms that come along with that. So just kind of being like, well, right now, this is part of what you're living with, and it's okay. Like, we can still have a good life.
Oh, that's a really important point. Now, a lot of your work involves, not only toddlers and babies, but also teenagers, right? You see children up to 18? Is that?
Yeah. And I actually go into young adulthood because that is a very important stage. But yes, I work a lot with teenagers. Yeah.
So can you give us an example of how a teenager may have a different response to GI pain than a young toddler? Are there more verbal cues, more than just verbal cues and things like that?
Well, I think with younger children who don't have the fully developed verbal skills to say, this is what's wrong with me, it's really looking at, behavior changes, sleep changes, appetite changes, those kinds of things that seem abnormal. Because a teenager has much more abstract thinking, they can experience more distress around the bigger questions of, why is this happening to me? How long is this going to last? Is this going to be forever? And that causes more distress. So it's more of that big picture thinking, and they can start to feel really hopeless.
We have so much to talk about, but I don't want to give away all the good stuff, because we want people to go and listen to your course, because they can stop it, pause it, take notes, listen to it again, and it's available on demand. And it's such a great course. But what kind of resources are out there for caregivers who may want to learn more about pediatric distress, gut health, and of course, behavioral and mental health, and all of the other facets of health for their children?
So there are some great books about parenting with chronic pain, and it's a nice evidence-based guide written for parents. There's one called Managing Your Child's Chronic Pain.
Oh, wow.
Yep. And then it's not GI specific, but it can
It's
apply.
helpful. Yeah.
Yeah. And then there's a great resource through Stanford called Imagine Action Lab. And this is something parents can offer their children. So it's for the children to use, but they
Nice.
are guided meditations targeting very specific symptoms. So they have pain, anxiety, nausea. There's a nice kind of intro video. So that's a really good tool. And then the Comfortability Lab out of Boston Children's Hospital has a lot of online resources for caregivers, teens, and children, including support networks, which I think is an incredibly important piece.
You do such an amazing job with your blog, Truth in Parenting. Love it.
Thank you.
I saw a post about autonomy supportive parenting.
Yes.
What is that, and how can it help children who are challenged with a GI disorder?
Oh, thank you so much for bringing this up. So I have a book coming out. My first book comes out.
Oh, that's awesome.
Next year, and it's all about autonomy supportive parenting, which is a very well researched but not as integrated into mainstream parenting guidance about how to support our child in feeling agency over who they are and how they live their lives. And it can really be done toddler through teenagers. And in terms of dealing with GI distress and medical problems, it's really huge because parents, we want to nurture and rescue our children when they are in pain. But when this is chronic, that does not help them feel more mastery and agency and confidence. They look at us to rescue them if we keep rescuing them. So autonomy supportive parenting can be a really important piece of parenting a child with chronic GI symptoms in the sense of really looking for areas of independence and encouraging that independence, expressing trust that they can do hard things, and helping them with emotional coping and building their own resilience.
This is great. I mean, it can even apply to children and families that don't have any chronic illness,
right?
To have that autonomy and to be able to make decisions and feel empowered.
Yeah.
And then the timing is perfect for this, I think. It's such an important, as we're faced with a bombardment of lots of different things and ideas, and everyone's confused.
I know.
Get back to basics. You're doing a good job. No, and it sounds like from our discussion, everything that you mentioned seems to reflect this autonomy supportive parenting, like all the tips that you gave, the way you're approaching the answers to our questions. So it was, you're actually practicing what you're preaching. So that's very inspiring and important. So thank you. So just to sum up, I just want to ask just one question about your course that you have on GIOnDEMAND. Again, we're so fortunate. Can you share a little bit about what a parent or caregiver of children could expect from your course online?
Sure. So I really lay out, the range of possible pathways in terms of getting into the pediatric GI system. But regardless of specific GI diagnosis and what's going on with the child, there are many common experiences for parents and families. So I really, in the course, touch on developmental considerations, what to expect, what to look out for in terms of behavior concerns, what parents can do to support their child, and then where pediatric psychology fits in as a supportive service for the family.
That's so great. And Emily, Dr. Edlynn, thank you so much for being here today and for your tireless efforts to help young patients, their caregivers, and parents cope with the side of GI disorders that often isn't discussed enough. So we really appreciate your being here. Look forward to your course. And when your book comes out, you better let us know so we can be one of the first to interview you and have some Q&A with you about your book. It sounds amazing. So thank you again.
I'd be happy to. Thanks so much for having me.
Great. And listeners out there, again, we love you parents. We're trying to help and empower you. And don't forget to rate and review us on your favorite podcasting app so we can keep bringing you amazing topics and amazing guests like Dr. Edlynn and amazing patients who can share their journeys with you. Thank you so much.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.